PRP injections for pain management. Pain is a natural alarm system telling us something's wrong. And when we talk about chronic pain, it stems from various underlying conditions, disrupting the natural pain response pathways. Pain is an intricate and pervasive challenge affecting millions worldwide. Traditional pain management, however, often focuses on symptom relief only. But what if we could address the underlying cause of your pain? This brings us to Platelet Rich Plasma, a therapeutic approach rooted in regenerative medicine. Hi everyone, my name is Dr. Kavita Katti and I am a practicing pain physician at Katti Hospital, Bagalkot. And we aim to spread awareness about pain management through the videos we publish on our channel. So please do consider subscribing to our channel. Now let's get back to the topic. Our body's natural healing cascade involves platelets, containing growth factors and cytokines that promote tissue repair and regeneration. And PRP therapy uses this very physiology in treatment of chronic pain. It is a well-known scientific approach now for regenerative healing. PRP involves 4 simple steps. First of all, a small amount of patient's blood is drawn. In the second step, we centrifuge it in a machine, which means the blood is spun to separate the red blood cells and plasma from the platelets. In the third step, the platelet-rich plasma is extracted and is concentrated. The concentrated PRP is then injected into the specific area of pain, like a joint or tendon. So how exactly does PRP help in relieving pain? Once injected, the concentrated platelets release the therapeutic growth factors. These growth factors help in healing and pain relief in 3 ways. Stimulating cellular proliferation. It encourages growth of new healthy cells to replace the damaged ones. Second is by reducing inflammation. PRP helps modulate inflammatory signals, decreasing the pain and swelling. Third one is by promoting angio neogenesis. This means stimulating of blood vessels forming and enhancing tissue healing and oxygen supply. Now let's quickly discuss what kind of pain conditions PRP can help with. First one is musculoskeletal conditions like osteoarthritis knee, tendinitis like tennis elbow, golfer's elbow, sports injuries like ligament tears and muscle strains. Next is chronic inflammatory conditions like plantar fasciitis and chronic tendinosis. In conclusion, the true testament to PRP's efficacy lies in the experiences of our patients. We've witnessed significant reductions in pain, enhanced functional abilities, and a return to activities that once seemed unattainable. Thank you for listening to me. If you're grappling with persistent pain and wondering if PRP could be the personalized solution you've been seeking, please don't hesitate to reach out. And before you go, do like and share this video, subscribe to our YouTube channel and press the bell icon.